A few days back, I showed you this ophthalmic sign, and now I am discussing this extremely important topic. So, but first we should know the anatomy of the eyelid. Normally, eyelid is firmly held in place by the anterior and posterior lamellae. Anterior lamella comprise of skin and orbicularis muscle, and posterior lamella contains dorsal plate and conjunctiva. Now normally these two lamellae they act against each other and lid functions. Normally it is held in erect position, but sometimes when the balance is lost, the eyelid either move inwards towards the globe, resulting in andropion, or moving outwards away from the globe, resulting in ectropion. Now you know what is ectropion and what is andropion, and in this case if you look closely, lower eyelid margin is moved outward, and this is a case of ectropion. So now we have determined that today's topic is about ectropion. Now another question comes that which type of ectropion we are looking at. Is it a congenital ectropion or acquired ectropion? And if it is acquired, like this 14 years old seems to have acquired ectropion, so which type of acquired ectropion? The most common is the senile age related, which occurs in old age, and she is 14 years old, so senile is ruled out. Then mechanical, due to some mass, some tumor on the skin side dragging it outward, so there is no such thing as well, so mechanical is ruled out. Then paralytic, due to facial palsy, but here you can see that the eye is closing normally and there is no paralysis, so Bell's palsy is also ruled out. So the last type is cicatricial. Cicatrix mean due to scar tissue formation after trauma or something else. So patient is 14 years old, female lady, and she had a trauma to the upper cheek. 2 years ago there was a wound, and that lead to this scar formation. Cicatricial ectropion resulted. So we have now diagnosed the case that our case is of cicatricial ectropion. Cicatricial ectropion occurs due to shortening of the anterior lamella, and we know that anterior lamella contains the skin and orbicularis muscle, resulting in outward rotation of the eyelid margin. Now there are many causes of cicatricial ectropion as well. Trauma is the most common cause, and our patient has also got history of trauma, so it's a traumatic cicatricial ectropion. But you should know the other causes of cicatricial ectropion. Trauma can be iatrogenic as well. Surgical trauma like excessive skin removal in blepharoplasty procedures can lead to cicatricial ectropion. Then burns, chemical burns as well as the fires, then skin cancers, ichthyosis. I have shown you ichthyosis case few days back. So all these and medications like anti-glaucoma medications, brimonidine and dorzolamide, they all can cause cicatricial ectropion. Now in order to understand the pathophysiology of cicatricial ectropion, we should understand the process of scar formation, that how scar tissue is formed. So for that you should know the stages of wound healing or phases of wound healing. So there are 3 phases of wound healing. The first is the inflammatory phase, which occurs from day 1 of trauma to day 5, and it is characterized by edema, erythema, temperature and pain. Then comes the second proliferative stage, and it lasts up to 4 weeks or roughly up to 21 day of trauma. In the proliferative stage, the small blood vessels, they sprout and they start into the wound, fill the gap, granulation tissue forms, fibroblasts start to make collagen in the wound bed. It strengthens the granulation tissue and wound edges begin to contract. And then comes the last and the most important stage of wound maturation. The third phase is wound maturation. Now it lasts from 21 days post trauma up to 2 years, and it depends upon various factors. We will discuss those later. Granulation tissue is strengthened, scar tissue is formed, and wound is matured up to 2 years time. Now wound maturation is affected by infection, local infection, irradiation, repeated trauma. There are other wound modulators like massage, antimetabolites, intralesional Kenacort. So scar contains fibrous tissue instead of normal skin. Extent of scar should be assessed during the treatment. You can assess the extent by palpation. It will be rigid, tough tissue to palpate from the surrounding skin. Its appearance will be little bit different. It can be raised or flat. Color can be of the surrounding tissue or little bit darker. Thickness, whether the scar is thick or thin, texture and maturity. So in order to correct the cicatricial ectropion, we also first need to assess the severity of ectropion. It has 4 grades. Grade 1 consists of punctal eversion, and some part of the posterior lid margin is not opposed to the globe. The grade 2, whole length of the posterior lid margin is not opposed to the globe. Grade 3, palpebral conjunctiva is visible, and grade 4, fornix is also visible. So our patient comes in grade 2 and 3. Now assess the maturity of the scar. Scar can be mature or immature. Mature scar is flat, color as that of the surrounding skin, and a good consequence of wound healing. Immature or hypertrophic is bad. It is raised, painful, and more contracture. Now scar tissue takes 6 to 12 months to mature and regain 7 to 80% of the tensile strength. During this period, we can modify the course of the scar and prevent formation of the bad scar. Now the techniques are scar massage, which decreases the itching, redness, pain, and causes mechanical disruption of the fibroblasts fibers, leading to formation of the softer scar. Scar massage should be started as soon as possible after the trauma, and in this case now it is too late to perform scar massage. But if she presented early, say 1 month after trauma, the scar massage should have been continued for 6 to 8 weeks. Other is pressure therapy, fillers like silicone gel, which fills the spaces, and there is less space available for the scar tissue formation. Then intralesional triamcinolone steroid injections and antimetabolites like 5-fluorouracil and bleomycin that can modify and reduce the scar formation. So in this moderate cicatricial ectropion, My plan is to inject 5 fluorouracil subcutaneously in the scar tissue. As you have seen that first uh, I have injected local anesthetic, and after 5 minutes I injected subcutaneously 5 fluorouracil in the scar tissue, and I will assess whether ectropion improves or not. I'll assess every 2 weeks, and if after 2 injections of 5 fluorouracil I didn't observe any improvement, I will go for the surgery. The other options are the surgical options are Z-plasty for very mild, but for moderate and severe the most successful surgery is lid release. Remove all the scar tissue in the area and then replace it with a skin graft from pre or post auricular area, supraclavicular area, or medial side of the arm or of the upper eyelid skin. Thank you very much.